Hi, everyone. We'll get started here. I would like to welcome everyone to the Washtenaw County Community Connector. Today is Thursday, January 21st, our first Community Connector of 2021. So thank you for joining us and participating at the end. We'll wait for Q&A at the end. We have some great speakers today, some great participants. Our first participant today will be Lindsay Mann Shanahan. But to back up, we're talking today about COVID-19 and mental health. As we know, our mental health has been greatly affected throughout the last year with the pandemic. And overall, the Community Connector is a way for all of us that are focused on elder care services to stay informed, engaged, and connected. And what I found is most important through all of this is that because of the ability to connect via Zoom, I know that we're all sick of it, but because we're able to connect this way, we've been able to connect with a lot of different kinds of people that we weren't able to connect with before. And so hence the reason we're going to continue these community connectors. We think it's been pretty cool being able to meet some folks in different ways. And I hope that you meet and hear from some folks that you may have not known in the past as well. We'll ask everyone to put their information in the chat function. And so if there is someone that you'd like to communicate with or connect with in the future, please feel free to reach out to them, especially if they've thrown their information in the chat function. Again, we encourage all participants to use chat, and then a Q&A will be at the very end. Without further ado, please look at the discussion questions. These are ones that we've asked the participants to kind of think about, simmer on, but by all means, if you have something else that you'd like to talk about today, feel free to do so. We just wanted to make sure that you have somewhere to go with the discussion questions. And everybody has about 7 minutes to talk today. And we're gonna, like I said, we're gonna start with Lindsay, and she is the outreach specialist for Huron Valley PACE and has some great insight as to what she's seen at Huron Valley PACE and with her residents there. Lindsay?
Hi, good afternoon, everyone. Can you hear me fine?
Sure can.
Yes.
Okay. So if many of you aren't familiar with PACE, our mission is to care for nursing home eligible seniors in their home. And by seniors, I mean those over the age of 55 and those also who are Medicaid eligible, which also makes our program free. So a part of my job as a marketing director is to spread the word of PACE, and to also, I've been doing intake assessments in our participants' homes. COVID has been a challenge for us, but it has also at the same time created more demand for our services than ever before. So I'll start with the first one, determine if someone is experiencing a mental health issue as it pertains to COVID. And that's a really great question. Many of our participants do have mental health issues, substance abuse issues, dementia-related issues, and many of them are scared and very fearful of COVID. Especially in the beginning of the pandemic, we had to stress that if it is an emergency to call 911 because they didn't want to go to the hospital for those true emergencies. We also have a behavioral health specialist, and we work with Dr. Maxner at U of M as well in a partnership. So we do a lot of those visits either virtually or in person. What would your treatment approach be? Again, depending on their level of cognition, we could do telehealth, we could talk to them over the phone, or we could do in-person visits. It just depends on the person. We're available 24/7. So ideally it would be easiest to talk to someone over the phone, and then other people may not even want you in the home. So that makes it even more challenging. How difficult has it been to provide teletherapy counseling to seniors? Extremely difficult. We did receive a grant to get iPads, but the issue is many seniors need someone to help them with the iPad. So then are we using our resources up to help with telehealth instead of just bringing them into our clinic? It's kind of a juggling act. And I think many of us have experienced that. For some, it works out great and it's wonderful. Others, it's much easier to get our transportation to pick them up and come into the clinic. If someone has a substance abuse disorder, directly or indirectly related, what do you do to treat the whole person? And we've had this happen. Some of them will go to a rehab facility for substance abuse, although they're very fearful because of COVID and being around more people. We increase counseling, we have our behavioral health social worker, and then we have one who specializes in substance abuse. So that definitely we have seen that get worse for many people because it's scary and they have nothing else to do besides. And if any of us turn on the news, besides yesterday, there isn't a lot of good things going on. It's kind of scary out there. And what can we as healthcare community do to support efforts of combating mental health issues? I think working as a team, we're all here for the same mission. So whether it's a client of Brianne's or a PACE client, if you see them out in the community or talk to someone, letting the other person know what someone's going through and communicating with the hospital systems as well. It's just, I think, just working as a team. And that's all I got.
Thanks, Lindsay. And I'm not sure if you're able to stay on for the whole duration, but if anyone has any questions specifically about Huron Valley PACE or what you've all been doing over there, I would love for you to stay on. Love hearing that you did receive the grants for the iPads. Let's keep on hoping that we can get those all figured out. And of course, it's always so nice that you have those wraparound services like the substance abuse counseling, because during this time, as we know, everyone needs as much help as possible. And hopefully we can reduce some of these fearful moments for our seniors. So I appreciate you bringing all of that up. Thank you so much.
You're welcome.
Throw your information in the chat if you don't mind. Great. So our next speaker is Karen Montz. Karen is the Director of Counseling and Grief Support at Arbor Hospice, and I would love to invite her on to speak. Karen?
Thank you so much. I appreciate you and for being here, and thank you everyone for this opportunity. I'm glad to meet you. I am with Arbor Hospice, and one of the things with our grief support program, we provide a minimum of 13 months of grief support for those who have lost a loved one on our program. But our services actually extend out to the community. So even if someone had a loved one who did not die on our program, they can still attend our support groups. They can still attend our grief support groups. So I think that is so needed right now. Early on in the pandemic, we actually offered a coping with fear, adversity, and just during these uncertain times. And we held that weekly for anyone in the community that may need it, because we just found that, I think that last question asking how can we support each other, even as organizations, I think we're all finding we are having to tap into each other for resources and support. And so we were open to anyone, any organization that needed to send somebody to that particular group. But one of the questions was asked is, how do you determine if someone is experiencing a mental health crisis or having mental health issues as it pertains to COVID-19? Well, I will say that with grief, we know grief is a normal part, of course, loss. But what we're seeing right now is that grief is magnified. So, people are just not experiencing sadness, but, because of the nature of this pandemic, a lot of people are expressing what is called depression, right? Or the anger is amplified because it's just not the fact that my loved one died, but I can't have the funeral that I want to have. And, maybe something that's going on globally that's affecting us, just everything that's going on in society. So everything is really magnified or amplified. And so then that does become the challenge, because there still is what's called this normal grief, but people really still are going to trying to figure out, is this grief a manifestation, a trigger, or is this really a mental health crisis at this time? So what we do is we really sit and we assess every single person who is a part of our patients. And when a patient and family comes on the program, they're going to get a social worker and chaplain. That's going to help us when we come in after the loss, and sometimes and even before the loss, to really assess what's going on and to find out, is this normal grief, which still feels very abnormal to the person who's experiencing it, right? So is this what we call normal grief, or is this person having complicated grief? When we talk about COVID, I've talked to a lot of people in the community, and I think what I'm hearing, and I'm sure everyone on this panel can agree, that you're hearing almost even some trauma reactions, right? You're hearing intrusive thoughts and distress, even as you have these symbolic reminders. It could be a commercial, it could be the numbers of people who have lost. And so you have these symbolic reminders, this irritability, again, this heightened grief. So I think, and then of course, we don't want to leave out some of the suicidal thoughts or ideations. So that's what I've been seeing, is identifying when somebody is really having what we call this crisis. And what it really is, our treatment approach. Well, at Arbor Hospice with our grief support program, or our grief journey program is what we call it, we mostly focus on education, supportive guidance, and supportive counseling. And that's what we provide. We provide that validation, that education and normalization. And really what I am seeing is that people really need a lot of normalization. Is this, and validation that just about what did I hear a couple months ago? Every counselor has a counselor right now. Every therapist is in therapy. So, sort of that validation that what you're experiencing, this pandemic of anxiety and pandemic of almost depression, you are very human. So I think people need a lot of validation with that. We provide that basic support and counseling and guidance. But again, we rely on this wonderful esteemed group here for other resources that we can refer people to. And we assess, are they having complicated grief? Because then if there's some complicated grief that we're recognizing, we are very pro referring people to outside resources, their physician, a therapist they have seen before. And how difficult has it been to provide teletherapy counseling? Well, I think we've been very fortunate, because we were able and have always provided sort of this one-on-one support with our patients and families, and community individuals. We've been able to do that telephonically very well for years. So that I think continues to be a very comfortable tool for our seniors, right? But when we came to having to switch our groups to a virtual format, and we switched our groups to a virtual format. And so if you go to our website, you can see all of the many web support groups that we offer virtually. That's a wonderful thing, but we do recognize there are seniors who don't even have a laptop, an iPad, and we've had the gift of being able to distribute some iPads as well, but also that may not just be comfortable with it. They feel like it's very unsafe. I think the wonderful thing is we're seeing seniors who are now becoming very comfortable with it. And I think that's a good thing. I'm seeing a lot more on our Zoom calls. There are some challenges, and we do have to sometimes do a little bit more teaching and take time to log on early. But I am really amazed how there is being this shift. I think as people are saying, this has not ended in 2 or 3 months. Let me get comfortable with using Zoom, even if that means let me reach out to my grandchildren so they can help me. And as far as substance abuse, disorder, or indirectly related to mental health, I think again, treating the whole person, we will refer out. We will refer out if that person needs Alcohol Anonymous or NA, help them to find counseling resources, rehab resources. We believe in the power of collaboration. No man really is an island. And our primary focus is to focus on the grief. But we do recognize that the difficulty in supporting someone, who may be intoxicated all day or majority of the day, that creates a unique challenge. We do education to let them know how, for example, alcohol can be a depressant. So while it may make you feel good for a moment, it will contribute probably to a more difficult and challenging healing process in your grief. So we do encourage to get some support in that area. And as far as what we can do as a community to help support each other, I mean, the community connector, you are really a witness and testimony of that. We need to hear what there's no man is an island. We've all got to share and support each other right now. So anyway, we can continue to collaborate, or we collaborate, for example, with a funeral home and trying to deliver services to the community, support to the community, and just making sure that we all know what's available. I just read an article, of course, where even telehealth counselors and therapy they're 2 and 3 months booked in advance. I talked to someone the other day and said, I can't get in to see a counselor until like March or April. I called for a doctor's appointment and a routine and was told, well, because of the backup, it could be April before you could get in. And so that means we've all got to rely on each other and support each other through this time. And so any way we can share resources, share information, I think that's what's going to be vital for us. So thank you. And please let me know if you have any other questions about our hospice or our grief support services.
Karen, that was great. I just love tapping into each other for support. It's absolutely necessary. And just hearing that you are looking at the whole person and trying to help the whole person, not just focusing on that one event, that one grief event. So thank you so much. I really appreciate you being on the call.
Thank you. Thank you for having us.
Absolutely. And so our next speaker is Elaine Pereira. She's the author and speaker of I Will Never Forget. And of course, we were talking before she jumps on, we were talking about all of us grabbing her book. I've heard that it's an amazing book and I'll have to grab one myself. If you've already gotten her book though, make sure to give her a review on Amazon, I think it is, Elaine, but you can jump on and tell us a little bit more and tell us about what you've been working with from 2020 on into 2021.
Oh, thank you. Just to circle back to the review, what I had said earlier is I've been asking for 5-star reviews on Amazon, not for the purpose of elevating my book above other great books on difficult subjects of dementia, etc., but to elevate those books so they get the recognition they deserve versus just some of our other fun reads like 50 Shades of something. So that is the reason I've kind of pushed that envelope just a little bit, is to encourage people to help put books on difficult subjects like this into a recognizable or a more acknowledged format. So that's what that's about. Thank you. Until, of course, COVID hit, I had presentations face-to-face across the country and have been honored to do so. I had 3 that were canceled in March and April of last year, and I'm only now getting reestablished to do Zoom events. But one of the things that I talk about when I meet with families, and I have reiterated it through the Zoom calls as well, is helping families and caregivers and professionals understand that as we get a little older and a little compromised by either dementia or, in this case, isolation, is lose our reserve. Every single one of us tuning in today, and every single person that you know who has had at least a few dark days, dark moments, significant frustration, anger, disappointment. You know, this has gone on now for a year. And when it first came about, I don't think anybody thought it would be that we would be in these shoes a year later. And here we are. But in our seniors, that little bit of extra energy that they have to put out to stay focused, to stay balanced, to stay on task, to not wallow in depression or isolation, that once that energy has been spent, very rarely is it restored. And so this is what I talk about to families is to recognize that their reserve is very minimal. So that said, that puts a population that's already at risk at even more risk while we are pent up, hunkered down at home. I wanted to talk, I realize this is a fictional story, but it certainly could be played out across the globe in real case scenarios. And if you happen to see Chicago Med last week, one of the physicians, I'm terrible with recall, but she is called into a telehealth call and is frustrated because she wants the person on the other end, even though you see this voice, this woman, come in for testing and all this. To make a long story short, over the course of 5 different clips of this telehealth call, the doctor begins to figure out that the woman has created a false scenario of ailments in order to basically get attention. And it's not in a pathological, it's not in a psychotic way. It's that in the story, again, her son has moved to Colorado. She doesn't have any contact. She's afraid to go outside. She doesn't want someone to come in to do lab work. Here we are. And I know that others who spoke ahead of me have touched on that just a little bit. We have to take an extra step to be the ones who initiate contact, phone, email, Zoom, FaceTime with those who are on the fringes. Those of us who are juggling 17 balls work-wise and don't have a spare moment to breathe, I get it. But what I'm saying is that if it's your mom, dad, friend, grandma, whatever, we really need to make them our priority. Send them one of those ginormous pictures of yourself. They were advertised at Christmas time so that you could do a hug with a cardboard cutout. Whatever it takes, be a little creative, because these little moments need to be repeated more often, I think, because our seniors are so isolated. The rest of the world is going on, managing to juggle Zoom, even though we're sick of it, and they're a little left behind. Even trying to get grocery orders. Like, I'm struggling right now to handle my second home delivery. I can't fathom how somebody alone who's 80 and not as savvy with a computer is getting their home delivery, because I'm stuck. So this is my point, is this idea of reserve and this idea of reaching out and really being the one who initiates, making sure that someone else is okay. Sometimes that tiny little phone call, that if you don't want to do a Zoom, if you're just tired of it, send a card. You know, we used to send snail mail. What? Sends flowers, do a card, do edible arrangements, do something. And I'm not talking about your clients. Not that that wouldn't be wonderful, but it would be expensive. I am talking about the people who are on the periphery who may need that little extra boost, that someone is caring about them. If it's your mom, there's a good chance that that dialogue is pretty ongoing. But maybe it's your aunt or somebody a little outside the bubble who doesn't normally get the kind of communication from you that would typically be there, and it may not be getting it from their own kids. I don't know. That's my kind of personal note on that. The technology issue is big. Like I referenced, trying to order my own groceries, and here we're asking other people who are not as technologically savvy as I think I am to do something similar. So these things can get really murky really fast. I also wanted to reference the unfortunate collateral damage that has come about through the COVID fallout. Those in their late, maybe those who are compromised anyway. And I don't want to pick an age group, but my former mother-in-law just turned 91. As recently as May of last year, she and I, she's in Michigan, or was, she and I were just waiting for the governor to open the indoor restaurant option or something so that we could go have coffee. But in a matter of a month, whatever she had left was gone. She started having hallucinations and it got pretty ugly, and she ended up being relocated into a memory care facility somewhere else. In a very, very short amount of time, she derailed, her reserve was gone, and there is no recovery. I hear she doesn't talk, there's no point in calling. I know these things can happen. And it is an unfortunate tragedy of collateral damage that goes along with this predicament that we're in. I would only add, if she had been my mother, I could have handled things differently. So if this is your mother, if this is your aunt, your best friend, be a little proactive and try to stop that derailing train from reaching its endpoint before we get to the point that there's no reserve at all.
Yeah. Elaine, I can't thank you enough for that call to action, and just hearing the reserve being depleted. I've never thought about it that way, but that makes a lot of sense.
Mm-hmm.
And just phone, email, Zoom, FaceTime, just sending pictures, sending flowers, all of those are just such great call to action and great small things that we can do, even if we're busy professionals on a daily basis. So thank you so much. I really appreciate that.
You're welcome.
And please put in the chat your book's name. Of course, I see it right there next to you, but also make sure to get that back in the chat as well, so we can support you, because we would love to do so.
I appreciate it.
Thanks, Elaine. All right, so we are moving on to James. James Kerrigan, he's a mental health counselor, and he is by phone only. So we're going to have to make sure that he has these discussion questions, or usually James has quite a bit to talk about. So James, are you there? Let's see if I can find you. James, can you hear us? Uh-oh, we might have lost him. I'm going to ask him to unmute. And if not, we'll move on and he can be the last speaker if we can get him off.
Hello?
There you
Hello?
are.
Okay, good. Yes.
Thanks. James, I introduced you, mental health counselor. If you'd like to add anything else, and just tell us a little bit about what you've been experiencing from the pandemic and mental health.
Yeah, I'm a clinical social worker and I have a private practice. I go into the home to do outpatient mental health counseling with seniors and individuals disabled, reimbursed through Medicare. And I can speak on COVID, both professional and personal. I was positive December 15th and gave it to my wife, but fortunately both of us have had mild cases. And so that's been a plus. I'm going to go off the rails just a little bit. I want to just maybe talk about one of my patients. And she's an 85-year-old African-American female, lives in Detroit. About half my patients are in Detroit and African-American. And she has a history of depression, history of anxiety. She's been on dialysis for a couple of years, significant physical issues. And histories of trauma in her childhood. 3 children, 2 adult children have died, both from cancer. So I've been seeing her for maybe 2-3 years, just an astounding, wonderful lady on her coping strategies. But right now I'm doing telehealth, but I'm still going out also. And she really liked me to come back out, which I'm going to be able to do. But one thing, in really almost piggybacking on what people have already said about the fear, despair, about grief. Someone once said all psychopathology is a loss and all psychotherapy is coping with a loss. But there's an added feature, I think, with COVID-19, especially with African Americans, as we're all aware of healthcare disparities. And as someone once said, most diseases are not medical, they're socioeconomic reasons for them. She's going to dialysis and she's in contact with other people, and that puts her at risk. And she's fearful of that. And that's really increased her anxiety and depression. She's isolated. She does have a son who and his wife live in Jackson. They do come and visit. But still there's that despair, like this is never going to end. And I think, I'm 77 years old, by the way. And you measure our years in dog years. You know, there's very little difference between somebody being 40 and 41. There's a big difference between being 76 and 77, or 85 and 86. When somebody says, well, it'll be over in a couple of years. Well, a couple of years, I don't know where I'm going to be, if I'm going to be here or not, or what kind of shape I'm going to be in. But the other added feature too, and especially with COVID-19 with African Americans, is not only the healthcare disparity, but dovetail into the trauma that many African Americans have been experiencing in the last 4 years, the last couple of years, the last year, with white supremacy, racism, Black Lives Matter. Brings back a lot of memories. Now, she's 85 years old. She grew up in a segregated South, you know, with separate drinking fountains, sitting in the back of the bus, all sorts of those indignities that many African Americans had to be exposed to. So that really dovetails, that whole aspect of trauma really dovetails in the COVID-19. The anger again, the lack of attention on many medical issues for many African Americans. The systemic denial on the part of many individuals and many healthcare professionals of really the impact of racism and of trauma on many African Americans. And that impacts the whole idea of COVID-19. I think somebody earlier mentioned it's simply another trauma that one is exposed to. So she's dealing with COVID-19. She's dealing with a history of racism against her. Yeah, and she's dealing with her own personal trauma of being sexually abused when she was a child. So she's dealing with a lot of trauma, and that really impacts her well-being, impacts her safety. Again, she has a suicidal history, although she hasn't been suicidal in many years. But still, there's that thought. She had earlier been institutionalized, and she was institutionalized down in Florida, and this was maybe in the 1950s. And you can imagine somebody who's African American being institutionalized in Florida in the 1950s. It was not a good, positive experience. So she's dealing with a lot of grief, and she's dealing with a lot of loss. The other impact, too, is financial. She's low income. And for many individuals can access, even when at home, technology and computers and all sorts of different things. It's much more difficult for her. And in fact, with many of my patients, they don't have telehealth in the aspect of visual. It's on the phone, because many can't afford all the technology. Unfortunately, Medicare and also Blue Cross have finally acknowledged that fact, and that you could just simply do audio also. There's a demoralization to it too. Is this ever going to end? And I do try and mention that there is a shelf life to this, like milk. You go to the grocery store, there's an expiration date. There will be an expiration date on this, but still, when you're 85 years old, or like myself, 77 years old, that expiration date on that milk may outlast me or my child or my patient. And there's a loss of also connections with. And church is another aspect too. She had always gone to church, and that's a very important socialization for many African Americans and others of going to church. That whole aspect of getting together with others, and that's contributed to a lot of the depression and to a lot of the anxiety. I think I've met my 7 minutes.
Thanks, James, and thanks for watching the time. I just, it makes so much sense what you're saying about that expiration on the pandemic and what we've all been working with, on top of the isolation, on top of personal traumas, the history of racism and COVID-19. It all sounds overwhelming. And with everyone, I know that you were talking specifically about this specific lady, but a lot of us have some trauma that we've uncovered sitting at home in isolation. And so thank goodness we have clinicians like yourself to help us through these times. I really appreciate it. And I appreciate your perspective.
Thank you.
Thanks. Our next speaker is Steve Anderson. He is the mental health case manager at Feinberg Health Care Solutions. Steve, I know you jumped on afterwards. You have about, after I got started here, but no worries. You have about 7 minutes to tell us a little bit about your perspective on COVID-19 and mental health.
Sure. Yes, I'm the Vice President of Addiction and Mental Health Services with Feinberg Healthcare Solutions, and we are a case management company that provides services for individuals who have been catastrophically injured, those who are in need of senior care, and also addiction mental health services, again, across those two populations, as well as those suffering from addiction and mental health. The approach that we take initially is doing a comprehensive assessment of the individual, but we really attempt to engage the family in that assessment process as well, and really get as many people involved as possible in truly understanding what the issues are with the individual. And some of the basic things we look at in an assessment are the social support systems. They're how satisfied or dissatisfied, what are those factors in life satisfaction? Is there repetitive or a source of ongoing mental distress, events in their life that creates that? And is there a history of depression and anxiety or other mental health conditions, as well as a full understanding of their physical well-being and status as well? So that's where we start, is doing a real comprehensive assessment And part of that, again, is really assessing what their resources are, who are the providers, and then facilitate communication and collaboration across all of those providers to assist in improving the individual situation. And I know that Elaine has mentioned this, and James alluded to it as well, is what we see in this population that is really contributing to mental health is the loss of human connection, not only with family and loved ones, but also loss of connection with community. And James spoke of church, and there are other communities that has created a separation from these individuals because of COVID. And this does have a significant impact on the individual's well-being, and also if they have a tendency for depression or anxiety or other mental health concerns, that certainly can bring those to light and also exacerbate them. And so that's what we've noticed as well, is a huge contributor to the uptick in mental health concerns as well as substance use, is that loss of human connection. And providing creative ways to help connect people. There have been a lot already mentioned, but that is so important. To keep that connection, to whether it be Zoom or again, all of the things that have been mentioned, a letter, gifts, contact, and really helping the family members to understand that as well, that routine connection needs to be improved under these circumstances. And the treatment approach that we take is really what we try to do is, again, really collaborate with the family, the person of concern, but also all of the providers to make sure that the providers are working in concert and they understand what are the medications and all of the treatments that are going on and what additional resources that individual will need. And if there are additional resources, that they're aware of them as well, and it becomes part of the total communication. We have not had a whole lot of difficulty providing our services through the telehealth model. In fact, it's really opened up some other opportunities and avenues for us. We do certainly assist those who need help with connecting through electronic devices and really assisting with those. But we've been able to provide nearly all of our services through the telehealth model. The issue about substance abuse being directly or indirectly related, again, that's a part of our assessment. And really what we've noticed, especially in the senior population, is that there can be some very subtle changes in alcohol consumption or other medications, whether they be pain medication or benzodiazepine. Any subtle change can have a profound effect on impairment and also addiction. And so we really look closely at that and try to monitor that use. And the approach that we take typically, but not always, again, it's guided by the assessment. It's really important to first get the substance abuse or addiction under control, or actually to an abstinence base, to really understand the underlying mental health conditions. It's sometimes very challenging when someone is reporting depression and anxiety, but they're taking large amounts of benzodiazepine or other substances and alcohol as well. It's really hard to differentiate. And so removing those substances will give a clearer picture of exactly what the status of the behavioral health areas are, and if they do exist, independent of the alcohol or other substance that can be treated, of course. What can we do as providers? First of all, I just want to say it's a pleasure to be a part of this group, and the respect that I have for everyone and the service that they do is absolutely fantastic. Some of the things that we can do is really increase awareness, not only in our communities and our profession, across professions, but also with family members, that given this pandemic, that there is an increased risk for mental health problems and concerns that need to be addressed. And also to send the message that treatment works, that there are options, that there are professionals and means to really assist individuals in reducing their depression and anxiety, and really learning how to manage that. And another kind of long-term goal is to really work with professionals and family members and whom we come in contact with about the stigma associated with seeking assistance and help for substance use disorders as well as mental health concerns. That this isn't about character weakness or poor constitution or bad decisions. This is about a condition much like any other chronic disease or chronic condition that needs treatment and management. And that's what we focus on, is not the individual necessarily, but that this is a condition that needs medical and psychosocial support and psychotherapy.
Absolutely. Absolutely.
And
Yeah. And I can't thank you enough for bringing that specific idea of helping family members understand routine connections, helping people understand that even subtle changes can have those profound effects. So I thank you so much for those wonderful points, Steve.
thank you.
Thank you so much. And we have our last speaker, Jenny Jarvis. Jenny, she is the Chief Communications and Strategy Officer at the Area Agency on Aging 1B. And Jenny, you have approximately 6 to 7 minutes, if you don't mind. And I'll ask her to unmute, see if we can get her off mute.
Okay, sorry, I pressed the microphone and usually that worked, but it didn't work that time.
No worries.
I'll keep it very quick. We've had so much wonderful, really very interesting information that's been shared already by so many great speakers. So thank you so much for the opportunity to learn, as I certainly have in the past hour. I just wanted to take a few minutes and quickly talk about family caregivers, those family members that are caring for older loved ones. We've talked a lot about the impact of COVID on seniors. And I think it's really important to remember those family members, especially those family members, the adult children that may have their older loved one living with them 24/7. And I think we have to be cognizant, in many cases, they sort of lost some of those informal supports as a result of COVID. The support they may have gotten from friends, from family members, with COVID and that concern about bringing people and, different people into your home. Direct care workers, if they had some paid services in place, whether it be them or the senior they're caring for, they're a little more nervous about having those senior services continue. We've seen seniors and family members sort of put a hold on some of those services in a few of our in-home care programs. So I think just being aware of that stress, and you've got working family caregivers who are juggling their work, potentially online schooling for school-based children, as well as caring for a senior. And what I quickly wanted to just talk about was a few programs that we've recently launched as an area agency on aging for caregivers that might be of interest for individuals on this call. And I'm on a Mac and it always works a little different, so I apologize. We started a caregiver coaching program. It's in Washtenaw and Livingston County, and it's volunteer caregivers who go through training. Many of them were caregivers previously, and they are connected one-on-one with somebody who's looking to be part, to working with a volunteer caregiver coach. So it's usually a connection that's made through our agency. We try to link them or, place them with a volunteer caregiver coach who would be, appropriate for them, sort of help meet their needs. And what it does is usually by phone or on Zoom. And they essentially are just a listening ear. They can help them understand caregiver challenges, help them find resources, sort through some of the tough decisions. So really, instead of just that other, like a fellow peer, a volunteer connection that they can have with somebody in their community. And we create that connection with those caregivers that we bring in and train through our program. We've also partnered with True Alta. That's an online educational portal for caregivers, primarily for caring for someone with Alzheimer's or dementia. And we are providing free 1-year access to family caregivers. And they can use the site to access videos, articles, slideshows on caregiving topics, aging and brain health, care planning, injury and fall prevention, personal care tasks. They can put on music that's appropriate, different stress techniques for themselves and the loved one they're caring for. And if family members might be interested in that, they can call our 800 number, our 800-852-7795 for more information. They can go right to our website and sign up for it. This one's really exciting, and I have about 2 minutes left, but we have just launched a new out-of-home respite program for family members just in Washtenaw County through a grant, part of the Vital Seniors program with the Ann Arbor Community Foundation. And we are going to help pay for 14 days and nights of out-of-home respite care per person per calendar year. It started January, just this January, at Memory Lane. You're probably more familiar than I am with it, but it's a licensed home in Ypsilanti that serves individuals with dementia or mild cognitive impairment. And we work on a voucher program. So essentially it's available. The senior who's going to be receiving the care must be 60 years of age or older. The family caregiver can live in Washtenaw County. They can live outside of Washtenaw County. And they would call our agency, and we link them up, and they make all of the arrangements directly with Memory Lane. And then we give them a voucher to pay for that service. So for many family members, that out-of-home respite's a very expensive option. And we are really excited to have this available for at least a year through this new grant opportunity. And again, if someone was interested, they can call our 800 number. And if you're not familiar with it, I'll throw it in the chat. And lastly, I wanted to mention the My Choice program. I think many of you are familiar with it, similar to PACE. It's a Medicaid program that pays for services in a community setting instead of in a nursing home. And we currently have availability in that program. We've run wait lists in the past, which could be a year or two long at some points, but we currently have availability. So if you were to make a referral, we can start working with that family to help move their loved one into that program. It doesn't mean it happens overnight. They still have to, if they don't have Medicaid, obviously go through the application process, et cetera, et cetera. But we do have availability in that program. And that was it. I just wanted to touch on a few new programs we have in Washtenaw County, as well as let people know about My Choice and availability in the program. So thank you.
Jenny, thank you so much. I loved hearing about True Alta. I've not heard of that before. So I'll look forward to hearing a little bit more about that, and we'll get that information out to everyone on the call, but please throw your information in the chat as well. Love hearing about the volunteer caregiver coaching. That's wonderful. Also, a lot of our family caregivers are always looking for those additional ways of connecting with their loved one in training and all of that. So that sounds wonderful also. So thank you for all of that.
All right.
Appreciate it. So quickly, I want to ask anyone if they have any questions, throw that in the chat. But also, I would be remiss if I did not thank Pandora Hall for reaching out to all of our esteemed speakers today and putting all of this together. It's no easy task, but she does a great job and she makes it look easy. So I appreciate that, Pandora. I can't thank you enough. And lastly, while we're waiting for any questions, Brian, do you mind moving over to the second page there? So, Okay, so our calls, we're trying to make sure everybody knows when these calls are. You should have received emails with each call throughout the entire year. So if you have not received that, call Pandora. I'm sure that she'll be able to help you with that. Our next call will be February 18th at 1 p.m. and the topic will be art, pet, and music therapy. We're always welcoming participants and we're always welcoming speakers. So if you know of anyone that would be interested in connecting with us, let us know. But with that, I'll open it up for any questions. I don't see any though.
We have one from Kathy Mitchell.
Oh, okay.
She wants to know, is the voucher program only for memory care respites? Anyone can answer?
I think
Yeah,
that's
that would be-
specifically towards Jenny.
Yes, it is specific for family members looking for out-of-home respite for someone they're caring for that does have some level of dementia diagnosis, simply because of the type of home that we have the partnership with. So they need to be appropriate for that setting.
Thank
Does
you.
that
very much.
answer the question?
It does. Yeah, I apologize. Somebody had called me in the meantime and I'm like, this is the one I really wanted to hear. And so sorry that you probably had answered that in your presentation earlier. Thank you.
That's fine. Thank you.
Thanks, Kathy.
Pandora or Brianne, can I jump in for one moment?
Absolutely.
My chat is not working. This is Susan from Feinberg Healthcare Solutions. I work with Steve Anderson. And I just wanted to throw out there that we support people both with mental health issues and substance use disorder through the whole continuum of care. So even if someone has gone through treatment, if it hasn't been effective, we can still use our resources, help with coaching moving forward, building, routine connection with coaching, the client, the family, anywhere from intervention to sober transport, which we do in person, not telephonically, to then telehealth, ongoing treatment. We're happy to be a resource in the area.
Thanks, Susan. Appreciate it.
Thank you.
Well, we have 3 minutes. If we don't have any additional questions, we can start wrapping up the call. Again, I just really appreciate everyone being on the call. As a reminder, we do record these calls and we will be sending them out to anyone that wants the additional resources. If you have any questions specifically about the chat function or who put anything in chat, please reach out to Pandora. She can get that information to you, especially if you need to make a connection that you've missed. But I can't thank everyone enough. Washtenaw County is near and dear to me and all of us here at Home Watch. So thank you so much for joining us today. And again, thank you to the speakers. So much great information today. So many amazing call to action. Thank you again. So without further ado, I will sign off and we'll see you in February. Thanks,
Bye. Thank you.
Bye.